Hi, I'm Dr. Rajani. Thanks for joining me today. You guys pushed me and you wanted to know the #1 glass skin procedure. #1 Korean glass skin procedure is what I was asked. So we talked about skincare. I talked about niacinamide in my glass skin skincare ingredient. Niacinamide is one of my favorite for all around less irritation, glow, brightening, all of those things. You can watch the video. But what about procedure? And I know many of you get confused because there's a plethora of people on here from all over the world. So for instance, in Asia, high frequency ultrasound known as Ulthera is one of the devices here in North America that's used. A lot of people ask about, then there's injectable RF. There's microneedling, there's derma rolling people talk about, but what's my #1 procedure for glass skin that's obtainable? I kept it obtainable, so it's not a high price tag. It's obtainable to most people, that I would say has minimal downtime, the least expensive, the maximal results, and that most people can do. So all skin types, colors, and people with problems such as immune disorders and so on can still do this procedure. That's what I'm going to talk about today. I'll reveal it and talk about it and what we use with it in 3 seconds. So remember, if you like the videos, click like. It's really important to our algorithm. The more we do, the better we do here, the more I can bring to you, the more in-depth knowledge. So like the videos, subscribe. You'll be notified if you click the bell to all the upcoming videos, so that's important. And there's this search bar here. So anything you might be thinking of, I'm sure I did a video at some point on it. Just go to the search bar, click in what you want. It will come up with a list of topics. Now, glass skin, skin glow. We know a majority of people need structure support, plasma sculptor, biostimulators to lift the face, PDO threads. But how do you address the surface? There are some people that are going to want to address the surface first. They're not comfortable dealing with structure support, fillers, and so on. For the most part, we want to do those procedures first, but the surface really makes a difference. Someone's walking down the street and they're 200 yards away and you see them. You often know roughly how old they are by how they carry themselves, the shape a little bit of their face and body, but the glow that they give back. So skin glow is important. And if you're younger, a lot of younger people have structure and support, but they want to get glow. Acne scarring, how do you treat it? My #1 procedure is my PlasmaGlo procedure, which is using a microneedling device like the Cosmo pen with platelet-rich fibrin infused, and it takes about 20 minutes. You can use anesthesia if you want, like a topical, but we can treat all skin types, most people, and if you've had filler, if you've had threads, if you've had a facelift, if you have melasma, I still treat those people. You can infuse different things like hyaluronic acid, like vitamin C, like niacinamide. There's a whole plethora of mesotherapy products. It's kind of why mesotherapy took a little drop injecting products in the face, because creating microchannels with these pens has taken over from mesotherapy a little bit. And it's an easier FDA approval than injecting something into the body like mesotherapy. So, what is it? People here use derma rollers, and someone commented the other day, I love the comments because it helps me. I know what's going on in the real world, so to speak, outside of my little world. And they said that there's evidence that the derma rolling seems to make the skin saggy. It causes problems. With derma rolling, you're rolling this device with needles over the skin. So when you're rolling it, you're forming cone-shaped openings, okay, in the skin. With microneedling, you get collagen induction therapy with the needles going straight at 90 degrees. It does seem to make a difference. I know it's subtle, but it seems to make a difference. Microneedling, you can see here on the pen, there's many needles on the pen, anywhere from 12 to 24 needles depending on the pen. I like the Cosmo pen. It's corded, it's adjustable, and the frequency of which the needles go into the face is predictable. Sometimes the cordless ones, the battery waxes and wanes. And the amount of microchannels we produce is important in layering your strokes, or your passes as we call it. What we do is use this to infuse what? In my case with PlasmaGlo, I love PRF, platelet rich fibrin. Now, a lot of people are going to ask me about PRF. I'll put a link to the video in there, but it's when we dry your blood, get your own body's healing and growth factors. There's no blood thinners in the tube. It's all natural. Spin it for 5 minutes, about 1,000 RPM, and it can form a clot. You can use the clot with microneedling if you want, or you can use the liquid form. It's great. The dentist pretty much invented it, I would say, and they use the clot for the tooth socket. They're amazing at doing this. And so we use either the clot or the liquid. I tend to like the liquid for microneedling. It's a little easier, and you can use pre-anesthetic or not. There's very little downtime, very little redness, but you want to avoid sun exposure afterwards. A lot of people will say, well, how many of these should I do in a year? I think people typically coming to my practice, I want them doing something every 2 to 3 months. And they might alternate it with a chemical peel, with a VFR, but the microneedling, if they did a PlasmaGlo procedure once every 3 months, that's great for addressing what? We often see brown spots decrease. There are other options for brown spots like IPL, like chemical peel. So it's nice to mix it up if brown spots is your primary concern, but it does seem to address brown spots. Pore size. Now, you can't get rid of the number of pores on your face. It would be great, but you can't. But what we can do is shrink them because they're producing oil. It's a gland that's producing oil. And if you don't take care of them with skincare, with things like PlasmaGlo, they get large and they're visible. So you don't care that they're there, you just don't want them visible. They actually can be protective. The oil, often people with oilier skin, as long as it's not producing acne and scarring acne, have better skin and a thicker dermis. So shrinking the pores, glow, overall glow. What happens as we age? You get a little acne scar. You get a little cut. You play hockey, you play sports, I got cuts all over here. The shield comes to here, you're getting cut up down here. I microneedle those. I use PlasmaGlo there, and it keeps it smooth. If you don't, and you have little step-offs here and there, what happens? The light doesn't reflect beautifully. You don't get that glass skin look. A lot of males aren't going to want a glass skin look. It's okay, and plus we shave and you have hair follicles and different things. For females, it's a lot more common to want a glassy look. And then of course skincare plays a role. Acne scarring also does well with this. Now, acne scarring is complex. There's many different types. There's box scars, there's ice pick, but acne scarring in general, it flattens, it smooths. If there's deep acne scarring, sometimes we need to go to radio frequency, injectable RF, plus or minus Bellafill, undermine the acne scarring. But PlasmaGlo with the microneedling of PRF does a great job of smoothing the skin. Of course, often you need several sessions if you have a lot of irregularities. Part of the problem is people come in at my age and haven't done anything until now. It's a little late. Doesn't mean you can't do it, but you're playing catch up. The younger generation, they start right off the bat. They know their sunscreen, they wear the hats, sunglasses. They start doing these procedures early, and this won't change the way you look. It's not like changing a cheek. It's not going to make you look different. Don't be worried. No one's going to know you had the procedure. I know there's still a group of people that don't want people to know they do anything. For many of my patients, they're like, if they don't know that something's been done, they're not happy. Why would you come pay money and look the same? You can just walk in, walk out. You want a difference. You want to change. You just want it to be either the way you want it to look, with a new angle, with a new fold, with a new projection, or you want it to look totally natural. Totally natural means you have those irregularities, you have large pores. It means you have wrinkles and folds. If you decide that, there's nothing wrong. But most people, when they mean natural, they mean I want to look like myself, but rejuvenated. Big distinction, especially when you go to your provider. Make that distinction. Don't say you want to look natural. Say you want to look rejuvenated in a natural way, but improve from the way I look today. So PlasmaGlo, That's the procedure. That's my number one fit for all of those reasons, for your number one glass skin procedure. Watch my video on the number one glass skincare ingredient and my other videos to keep your skin and body beautiful, healthy, and vibrant.